We're going to start today talking about anxiety because we know it's very common among individuals with autism spectrum disorders. So we know that kids and youth on the spectrum are at increased risk of developing anxiety at higher rates than their typically developing peers and at higher rates than their peers with other neurodevelopmental disabilities. Recent statistics from a national needs assessment study that was done suggest that about a quarter of all school-age kids in our province who have autism also experience clinically significant anxiety. And studies of broader populations indicate upwards of 40 to 50% of all kids on the spectrum have at least one anxiety disorder. And unfortunately, we're finding that, in fact, many of them have multiple anxiety disorders. That's often the norm, I think, in our practices. So we're concerned about anxiety because kids are suffering and because it reduces their quality of life. But we're also concerned because anxiety impacts many other important domains of functioning. So, for example, anxiety often exacerbates the core symptoms of autism. It can amplify already rigid or sort of black and white thinking patterns. It can aggravate autism-related sensory sensitivities. It can compound existing social skills difficulties. And anxiety often interferes with many other aspects of daily life as well, such as participating fully in autism treatment, developing daily living skills, and increasing independence. We know that anxiety can be a real barrier to learning and academic achievement in school settings. And families will tell us that anxiety can have a significant impact on relationships within families and family functioning as a whole. So the trouble is that anxiety is often not picked up. Anxiety symptoms are often sort of incorrectly attributed to autism. For example, we might assume that a child who tends to avoid social situations does so because they're not very interested in social interactions or because social interactions aren't very motivating for them because they have autism. But if we assume that and don't consider the possibility of, for example, social anxiety, we miss an opportunity to pick up that this child might also have social anxiety that we could target with treatment directly. We call this diagnostic overshadowing, and it really is a significant barrier to these kids and youth accessing good treatment for anxiety. So that's sort of the bad news. The good news is that the field is moving toward greater consensus around methods for assessing and treating anxiety in children and youth on the spectrum. And so Autism Speaks has done some really lovely work in this regard. Their Autism Treatment Network and Autism Intervention Research on Physical Health Anxiety Work Group have developed an algorithm for assessing anxiety. And I'd like to spend a little bit of time tonight running you through that because I think it's a really useful, really practical resource. So the first step in assessing anxiety, according to this algorithm, is to assess using a developmental lens. So we want to be thinking about things like, what is the cognitive level of this youngster? What's their developmental level? What's the degree of insight they have into their own internal experiences, their feelings, their emotions, their cognitions or thoughts? We want to be thinking about what is their ability to communicate about their personal experiences. So sort of using that developmental lens. We also want to gather information from multiple informants. So of course we're going to be talking with parents and other caregivers. We're probably going to talk with staff from the school and other professionals who are involved in the youngster's life. And then the recommendation is to use multiple methods of gathering information. So most of us, I think, use clinical interviews pretty regularly in our practices, and certainly those are recommended. We also recommend using rating scales or questionnaires, as well as behavioral observations. So to the extent you can, ideally, we'd be observing kids in the moment in the situations where we think they might be experiencing anxiety. But at the very least, we want to gather reported observations from others who have opportunities to see kids in various situations. And when we're observing, what I think about is I'm looking for a child who's sort of the evidence that the fight or flight or freeze response for this child is really easily triggered and is really intense. So that can look a lot of different ways. It can look like a youngster who avoids or bolts out of anxiety-provoking situations. It can look like a teen who just puts their head down on the desk, or stops talking and stops making eye contact, or sort of shuts down or withdraws. It can also look like physical aggression toward others or self-harm against the self. So it can be pretty varied. When we see kids in the office, in terms of a physical exam, we might be looking for things like an elevated heart rate, increased blood pressure, sweaty palms, all of those physiological symptoms that we know go along with anxiety. Okay. So the second step is we want to assess kind of two different kinds of anxiety. There's increasing interest in folks who see kids with autism in this idea that there are maybe two tracks of anxiety for kids and youth on the spectrum. One track being that sort of traditional anxiety that follows DSM diagnoses. And we know that kids on the spectrum are most likely to experience social anxiety, generalized anxiety disorder, and specific phobias. But we're beginning to think that there's a second track of anxiety that's more atypical for people on the autism spectrum, and much more often idiosyncratic to the individual. So that's things like green foods, or elevators, or corners, things that are really not commonly seen. So we think about that as ASD-related anxiety or atypical anxiety. Of course, one of the challenges is that anxiety and autism symptoms often overlap. So if a youngster has a really strong reaction to slimy food, do we conceptualize that as a specific phobia around slimy foods, or do we conceptualize it as a sensory sensitivity? Or maybe it's both. And so these things are not always crystal clear for sure. Sometimes we can tease it apart by looking at behavior and maybe doing a functional assessment, and sometimes we can't. And that's okay, we don't have to have all the answers. Okay, so the third step in assessing anxiety is going to be assessing and treating psychiatric disorders or symptoms and other medical conditions that might be causing anxiety or contributing to anxiety. So, for example, if a youngster has untreated or poorly managed ADHD, that may make it difficult for them to succeed in their schoolwork, and that might contribute to anxiety about taking tests at school, attending school at all, doing homework assignments, these kinds of things. So we would want to go make sure that we're addressing psychiatric concerns like ADHD that may be contributing. Sleep is another big culprit. We know that kids on the spectrum often have difficulties with sleep, and when we have poor sleep, it increases anxiety. Of course, when we're anxious, our sleep is also impacted, so it's a bit of a cycle. So there may be room for intervening around sleep difficulties and impacting anxiety through that mechanism. And then the last thing I wanted to mention is just to keep an eye out for medication side effects. We know there are a number of medications that cause or contribute to anxiety. Pretty common things like bronchodilators for asthma, or allergy medications, or stimulant medications. And then the fourth step in assessing anxiety is to be on the lookout for psychosocial stressors in the youngster's life. So this could be anything from caregiver burden and burnout to parental anxiety or mood-related concerns to conflict in the marital relationship or between the parents. So we want to make sure that we've identified any of these psychosocial stressors that might be increasing the youngster's anxiety and then intervening at that level. The other piece we want to keep an eye out for, and I think this is quite a common one, is suboptimal supports. So we want to be looking for example, a youngster's communication needs that aren't properly met, or an individual education plan that doesn't fully meet a youngster's learning needs. Or just unrealistically high expectations for a youngster in the absence of sufficient support to really set them up for success. So we're looking for these psychosocial stressors and suboptimal supports and intervening at that level. And then we see what's left over. Does this child still look clinically anxious? They might. We're going to be looking at how much anxiety is interfering with daily functioning and how much it's interfering across different contexts of the child's life, and that helps to sort of inform treatment planning. So the same Autism Speaks working groups that developed that algorithm for assessing anxiety also developed an algorithm for treating anxiety. These are all in your reference lists. And so I'd like to spend a few minutes on this, again, because I think it's a really practical tool that walks us through how to help these kids. So the first step isn't really treatment as we might traditionally think about it at all. It's psychoeducation. It's helping children and families and those around them understand what anxiety is all about, the factors that might maintain it over time. As well as care coordination, and I think this one is a really important one, making sure that there's good coordination between home, the school-based team, and any community teams or professionals that are involved in this child's life. I really think we can't underestimate the importance of this piece, because if we're working at cross purposes, we really may be doing a disservice to these kids and families. So this involves case management often. Okay. The second step in treating anxiety is to provide modified cognitive behavioral therapy, or CBT, which I know many folks here will have heard of. There's a preliminary but really rapidly growing body of research demonstrating that modified CBT, particularly with higher functioning individuals, children and youth, can reduce the severity of anxiety symptoms and the number of anxiety disorder diagnoses that children have. So just briefly, because I know a lot of people are already familiar, CBT is an evidence-based form of talk therapy that really works on the premise that, can you see when I do this? No. Okay. That how we think, or our cognitions, and how we behave, our actions, impact how we feel and how we function. And so CBT really focuses on changing unhelpful thoughts and unhelpful behaviors in the service of improving how we feel emotionally and how we function in the world. And we absolutely can provide CBT for many individuals on the autism spectrum. And if you don't get anything else out of tonight, that's the message. I think about CBT for this population as big B, lots of emphasis on the behavioral end, and little c, less emphasis on cognitive. And so I just wanted to share with you a few key highlights for how to modify CBT for kids on the spectrum. So the first one here is we have to involve parents or other caregivers as coaches and really almost as co-therapists for these kids. 3, okay, I can do it. Thanks. I'm getting my 3-minute warning. Because we know that these kids need extra support to pick up the skills that we want them to develop. I'm going to skip the next one, visual supports and hands-on activities, because you all know about that. We used loads of modeling and lots of practice opportunities and loads of repetition across different contexts of the child's life to really support the generalization of skills process, because we know these kids need lots more support and opportunity around generalization. It can be super effective to incorporate a youngster's special, unique interests into the therapy process. It can really increase motivation and help them be super engaged in therapy. So we really like to do that. I can't emphasize the importance of providing positive reinforcement and rewards for kids participating in therapy, doing their therapy homework, facing fears a little bit at a time, showing brave behavior. All of that is really, really critical for helping them be motivated to do this work, which is really hard for them. And the last piece I want to emphasize is addressing underlying skill deficits. So for example, if you think about a youngster who's really anxious entering into a new social situation, there might be really good reasons for them to be anxious. They might not know how to enter into that group. We can do as much anxiety treatment as we want. If we don't teach those underlying skills, then the youngster's not going to benefit. We have to do exposure with these kids. Relaxation training, cognitive work alone, it's just not going to do the trick. And exposure, as many of you know, involves facing fears in a gradual, systematic way, starting with easier steps and working up from there. There's some really good now modified CBT resources available, and I'd like to just suggest that you have a look at them if you have any interest in this area at all. Sometimes modified CBT isn't appropriate for a youngster, or they don't benefit from it as much as we had hoped, and that's when we want to think about medications. And so most typically we'll use SSRIs to treat anxiety directly, and the mantra here is start low and go slow. We really want to monitor closely because we know that these kids are more susceptible than others to side effects like behavioral activation. But we might also use medications to treat other anxiety-related aspects of their functioning, like sleep disturbance or anxiety-related behavioral difficulties. And there's a great algorithm that's part of your reference material as well about medication use for irritability and problem behavior. Okay, take-home messages. Be on the lookout for anxiety. If we don't pick it up, we can't help kids with it, and it does have really far-reaching effects. There are good evidence-based resources available to guide assessment and treatment of anxiety for children and youth with autism spectrum disorders. CBT can absolutely be modified for many kids on the spectrum, and please make sure that they're getting exposure. Medications can be an important part of a treatment plan, and there are good resources to guide those decisions as well. Thanks for your attention.